On an ambitious plan or an environmental cop-out, the government has announced it wants to make 90% of the country's rivers and lakes swimmable by 2040. The swimmable target is based on meeting the water quality standard at least 80% of the time, in line with European and US definitions. The Environment Minister, Nick Smith, says there are changes to the way faecal contamination is measured in waterways, but that does not mean more contamination will be allowed. He says the Ministry of Health guidelines require that for water to be swimmable, it has to be better than 540 E. coli bacteria per 100 millilitres of water, and that's not changing.
What we are changing is the way we report different river standards. That is, we're saying those rivers where that standard is more than 95% of the time is an excellent river. Between 90 and 95% of the time is good. Between 80 and 90% is fair. Less than that is being described as intermittent, and less than 70% is poor. Now, that's a different way of measuring from the average level that is recorded over the full period of a year. And so, for instance, the previous table was focused on the mean rather than the proportion of the time that a river meets a standard. Now, the reason for the change is to get that focus on improving the proportion of the time that our water bodies are able to be swimming. And secondly, it enables us to be able to give Kiwis practical information about where they can swim. That is, for those that are less than 70% of the time, we're saying you shouldn't swim at all. If you're in that fair category, you should be checking with the Leiwa website. For instance, right now, they've got data on 200 plus sites where about 10% of them are not meeting that standard. If you take a typical river like the Manawatu River and you apply the two different methodologies, it does not radically change which category a river is in. It's just a different way of measuring it.
So that's Nick Smith. We spoke to Kevin Haig from Forest and Bird after the news at 5 this evening. He says he would have been able to say well done to the government had they done well, but they didn't. He says that they have simply shifted definitions, quite contrary to what Nick Smith was saying there. That interview with Kevin Haig is now available online. But let's talk about people who deal with what happens if we end up inhaling or ingesting or taking in contaminated water. The Rural General Practice Network says it understands that under the revised standards, the water that New Zealanders can swim in will be riskier in terms of exposure to E. coli. Sharon Hansen is the chair of the network. Sharon, are you there?
Yes, I'm here, John.
Hello, lovely to talk to you. What is your take on what this means in terms of our health via exposure to water in our rivers and lakes?
It means more risk, and that's a considerable worry for us. When I was a kid, I could take my dogs down the river and I could swim in the river, and did so, as did most rural New Zealanders.
Where were you a kid?
I was a kid in South Canterbury.
Okay, and so there has been a real change in water in South Canterbury, hasn't there, since your childhood?
Yes. In the whole of Canterbury, I understand, and many other parts of the country.
Okay, so in terms of health outcomes, what does that change mean? You are saying, quite contrary to what Nick Smith is saying, that there is in fact a greater risk.
Well, I am saying that there is a change from many years ago, and that change has been considerable. It has changed behaviour, and particularly recreational behaviour of the local people. Now, I don't have at my fingertips any information on what that means in absolutes as far as disease process and what those rates would look like. But I can tell you from a practice point of view, we see people with rashes if they swim in the river. We hear about people not being able to take their dogs down to the river, and I certainly wouldn't take my dogs near the river.
So, Sharon, forgive me. So you were, because we've only just met, but you work in a practice, right? You work in a...
Yes.
Okay. And you do see people with waterborne illnesses?
Yes, we do.
Okay.
Yes.
And has it become more common?
Look, I would think anecdotally, yes, John. It has become more common over the years. I don't recall any situation in years gone by. There may be. I'm not the I'm not privy to the figures on that.
Absolutely, but that's your experience. So if we look forward to 2040 and what Nick Smith is promising, is that reassuring for you?
No, it's far too late. This is ridiculous. This situation should never have been allowed to get to the point where it is today. We shouldn't have a situation where our waters are barely wadeable, let alone not swimmable, or the water can't be drunk by livestock or animals. This is not right. And, the government has been slow in making changes that stop the progression of these rivers deteriorating.
I guess some of the people who come into your practice are farmers. And,
yes, they are.
And this is the balancing act I guess the government's trying to achieve. How do you make water safety without crippling farming with the costs and the measures required?
I can tell you anecdotally again that the conversations that I've had with farming families, that they're concerned about the water quality as well. Their children swim in the rivers. We haven't got swimming pools and we haven't got recreational facilities. So our playground is our rivers. And so this is a concern to all families.
Sharon Hanson, who is the Rural GP Network Chair, joining us live.